I'm going to do insert a Foley catheter into a female, and then I'm going to go straight into indwelling catheter care as soon as I get done with that. So for the insertion of the catheter, what we want to do is we want to check our physician's order and gather our supplies, and then we want to come in and identify our patient, check for any allergies, and then we want to go ahead and wash our hands and put on gloves. And then we're going to position the patient into the dorsal helmet, explaining to them what we're doing. Put them in the dorsal helmet, and then we would have a little pad down and go ahead and perform perineal care. Get that out of the way, we would wash our hands and take off these gloves. And then we would go ahead and start opening our packet. So with the packet, we're going to go ahead and always open it away from us. Use this back here to put to this far in the crack. Okay, now we're going to open this away, making sure we only touch no more than the 1-inch border. First thing that we have is our gloves, sterile gloves, so we're going to go ahead and put those on. Again, on these, touching just that outer border. Now we are sterile, so now we can go ahead and start looking at our contents in our box. So first thing we have is our absorbent pad. So we would put this underneath the patient, and the patient would actually be able to, she would be able to raise her body up for us if she was real patient. Now we have our other tray. Patient. Okay. And then we can get this out. Go ahead and open our specimen here. Go ahead and put our lubricant in our tray there. Go ahead. There. Lubricate 1 to 2 inches for our finger here. Rest. Go ahead and uncap the syringe. Then we've got our alcohol swabs to clean. Now we're going to go ahead and clean our patient. So with this non-dominant hand, I'll break the sterility with it, and I'm going to go ahead and open the patient up, and we're going to clean top to bottom. Top, bottom, and we're going to the middle. Now this is our lubricated already, so we are going to go ahead and start advancing this 2 to 3 inches to our patient. We would have our patient take a deep breath. We would not push against tight resistance. We can twist a little bit if it doesn't go in, and we want to be careful that we don't break sterility with this hand. And we're going to push this in until we see the flashback of urine. We go a little further. inches. And then, once we're there, I'm going to go ahead and we would empty the whole contents of the syringe and fill up our balloon. And then we'll make sure that we don't get any, that it doesn't come out of place, and it doesn't. So now we're going to make sure that we leave plenty of slack so the patient has room to move, and we secure it to the patient's leg. This bag we would secure to the bed frame and make sure it doesn't touch the floor. That's the procedure for inserting the catheter. So now I'm going to take off my gloves, and I will go ahead and document, wash my hands, and then document. We want to document the time that we put the catheter in. We want to document size and the type of the catheter that we used, the urine that we got back, where everything was placed, how the patient tolerated, all that. We would have cleaned up all of this from the patient, and now we were coming back to do indwelling catheter care. So for indwelling catheter care, what we're going to do, just out of the way, is we would identify the patient, gather our supplies, and we would come in, wash our hands, maybe put on. Go ahead and tell the patient what we're going to be doing. And then I go ahead. So none of this would be here. I would put the patient in the recumbent position to get her good and clean. I would put an absorbent pad under her to keep a mess off of everything. I'm going to go ahead and unsecure this from the securing device, let it loose, and then I would have some washcloths and things to clean her with. So we would take the non-dominant hand, pull enough open, and clean with soap and water from top to bottom. If we're using a rag, we fold down, use the other side, flat down, top to bottom. Same thing for the middle, top to bottom. Then I'm going to clean that away with water. So rinse it away, same thing again, top to bottom, top to bottom, top to bottom. Then secure the tube, the catheter here, clean it about 4 inches down with soap and water, and then rinse. That way, and then we're going to make sure the patient's dry. Everything's dry that we did. And then get everything out from underneath her, secure her catheter back to the securing device, make sure that she's comfortable, take gloves off, wash hands, and then I would document.